What is your hope for the future?
Wow. Sorry.
In March 2024, the Academy of Medical Sciences and the US National Academy of Medicine launched a new bilateral policy project. The project brings together a group of future research leaders from different areas of expertise who want to explore the health and research policy implications of climate change. The project will provide the group with policy experience as well as connecting them to international peers. During the first workshop, the group came together to explore their commitments, hopes, and ideas for the project. The group will work together over the next year to propose policy actions that the health research sector could take to address the challenge of climate change.
So we are already seeing impacts of temperature variation with premature births. We're definitely seeing a rise in zoonotic infections, and this all ties together into the situation of how are we going to integrate health, community, and system transformation.
Nurses are already being impacted by climate change. They're seeing it in every aspect of their work in terms of who they're serving, how they're working, the conditions, and they're seeing it on a global scale.
It is a crisis that spans global issues, it spans countries, it spans politics to economics to health, and so it's one that's really complex to solve as well.
We need diverse voices for this problem because for me specifically, coming at it as an Indigenous person, they're often left out of the conversation, and they're often their voices aren't heard, and they are the original stewards of this land. And so I think that the answers that they hold is already there. Let's tap into that, let's get those answers, and let's build something together that's really proactive.
What made me want to be part of this project is that as an engineer, I know there are people working in other sectors who've made positive changes in terms of sustainability and net zero, and wanted to see if I could help bring those to healthcare.
I think we need innovation because we know what works, but we don't know how to make that work in practice. And I think it's fantastic to be here today and hear from lots of different cadres of researchers and healthcare workers to think about solutions together.
Nurses need to be part of this conversation because we will be on the front lines responding to what is happening with climate change, whether it's a disaster response, increased migration, changes in health systems, moving toward a net zero sustainable health system as well.
The planet is often pitted against the patient. And I think we need to break down that stereotype and realize that sustainable healthcare is better for the patient, it's better for the planet, and it's better for cost.
The National Academy of Medicine and the Academy of Medical Sciences have a rich history of being able to support and improve medical sciences for the respective countries in very powerful ways. But if we can bring diverse thought, diverse populations, and diverse perspectives into the equation, I think we can truly move the needle in the direction that we need to move right now.
We need to tackle this now urgently because we are already seeing the consequences of our inaction, and now is the time to be proactive and collaborative because there is no planet B.